Welcome to the Medical Marijuana and Wellness webinar series. Tonight's topic is anxiety, stress, and medical marijuana. But in the meantime, we have a number of folks that I think are here to help answer your questions and bring some information to the table. First, I'd like to introduce Amy Green. Amy is a nurse at the MMTC clinic in Florida. Amy, welcome. And by the way, thank you very much for helping me with the video.
Yeah, absolutely. Marc, it's so happy to be here, and I'm just happy to be able to help with stress and anxiety any way I can.
Yeah, you spend a lot of time during your day really helping with patients and advising them on how to use medical cannabis. So you've got what I call a lot of scar tissue in this area.
True.
That's really true. I'd like to introduce some folks who are joining us from Surterra, because rather than just talking about theory of medical cannabis, we like to present to you a solution and a place that you can get medical cannabis assistance here in Florida. I'm going to start by introducing Forrest. I'll introduce you. Forrest, you're the marketing manager, and I'll let you introduce your team.
Sounds good. Thanks, Marc. We're happy to be here again. Loves, who is a manager at our store on Jacksonville Atlantic Avenue. So I'll let them introduce themselves. Zach, I'll kick it over to you.
Hi, my name is Zach Fleming. I am the market president for Surterra Wellness here in Florida. I've been with the company since 2017, so the earlier days of the program. Pleasure to be here today in front of everyone and get a chance to answer some questions from the patients we serve, and happy to be here.
Zach, we appreciate your diligence running the company. We're also going to test your knowledge of cannabis tonight.
All right.
It's there. Taylor, thank you very much for joining us. You have really provided a lot of information for this webinar. Tell us who you are and where you're located.
Absolutely. Welcome, guys. Thank you guys so much for joining us, and thank you for having me as a host. My name is Taylor Jennings. I'm a store manager at the Jacksonville Atlantic Boulevard location here in Northern Florida. And I'm just excited to be a part of this and answer any questions that I can. So thank you very much, guys, for having me.
This is great. Now, we prepared a video today to talk about anxiety and stress. And then right after that, we'll talk about actual products that you can pick up and be able to use to help you with this particular condition and answer your questions. I do want to mention this video is intended for informational purposes. Naturally, if you have any medical issues, contact your doctor, your practitioner, or your medical marijuana doctor. So that being said, let's go right to the video and let's get into helping with anxiety and stress. Welcome to Medical Marijuana and Wellness. Today's topic is anxiety and stress with medical marijuana. Joining me today is Amy Green, an RN and a practitioner at MMTC of Florida in the Villages. Amy, welcome.
Hey, Marc, it's great to be here again. I'm excited to talk to everybody about anxiety, stress, and how medical cannabis can help them.
And you see a number of patients that actually have this condition in your particular practice, don't you?
Absolutely. One of the most common conditions that patients are qualified for is generalized anxiety disorder, and that can actually cover several different types of anxiety.
Mm-hmm. Well, let's talk about what is anxiety and stress. I know that stress is a physical and mental response to an external source, and I think it goes hand in hand with anxiety.
Absolutely. So anxiety is your response to that stress. Some stress can be beneficial to your body, but anxiety happens when the stress is overwhelming or the stress is escalating to a point where it's uncomfortable.
Mm-hmm. Yeah, and when you take a look at what stress is, it's the symptoms. What happens? How do you know you're stressed? Well, you get your blood pressure increases, you get chest pains. In many cases, like fear, small amounts of stress can actually motivate you. I know that as an athlete, when I played golf, for example, competitively, I would, although I was very stressed out, I kind of use that as a way of motivating myself. And I think that's what's really important, although you don't want to let it get to the point where it overwhelms you.
Absolutely. And having that differentiation between what is stress and what is anxiety is very important. That way you can sort of categorize, this is a stress response and this stress response is causing my anxiety to cause me to respond in a certain way. Like what's up here, it might just be that persistent feeling of dread or apprehension, but it can be caused by a lot of different things. Anxiety is not necessarily only caused by stress. It can be exacerbated by genetics, brain chemistry, or lifetime events, such as
Sure.
anything stressful or post-traumatic.
Right. And it's interesting that anxiety is something where people just feel that dread and that apprehension, but it also has a lot of complex factors. I know that it's one of those things that it's hard to exactly nail down, except for saying that you have it. And what's interesting is there's a lot of people worldwide. They say that 264 million people worldwide have anxiety disorder, and 31% of Americans will experience anxiety over their lifetime.
Absolutely. And it's just the first step to being able to treat anxiety is recognizing it.
And that's what's important. I think that if you have the situation, don't think that you're alone. Don't think that you're the only one that's there. There's a lot of people that have it. There's a lot, and it's a condition that is very real. So really pay attention to it and take a look at some of the alternatives. Now, as I mentioned before, stress is a response to situation. Anxiety is reaction to that. But in many cases, it can be used. It can be used. The signs of anxiety, which are worry, fear, and that type of thing, can also be used as a motivator.
It can, yes. So it kind of goes hand in hand with our flight or fight response. So part of that is you have a stress input and your body has to choose how it's going to respond to that.
Mhm.
Are you going to fly away? Are you going to run away? Are you going to have that extra stamina and strength to be able to run away? Are you going to engage and fight? All of those stressors create anxiety, and how that anxiety manifests in people is different for each person. It might be nervousness, it might be worry, it might be fear, but how they, gosh, how do I say this? How they interpret their anxiety,
right,
is a very personal thing.
Sure. And I learned from a number of my coaches early on how to channel that stress and how to channel that anxiety to be a motivator and to help me perform better. But again, that took some training, and it's something that's not for everybody. But again, if you have a persistent and it's overwhelming, you may have an anxiety disorder, and you may need medical advice for that. That's important to understand.
Absolutely.
Yeah. So let's talk about why cannabis is such a big deal. I know that it's been known that cannabis helps with anxiety and stress. We all have a nervous system, and I think we've all known about our nervous system for a long time. And I tend to look at the nervous system as the cell phone system of the body. It's how the body communicates from one part of the body to another. If we hurt our finger or hurt our knee, the signal travels through your nervous system to your brain and says, "Houston, we have a problem." This is something that we've known about for a long time.
It is. And the nervous system is a very well-studied system of the body. It is what coordinates actions and sensory information. So if I stub my toe, it's going to tell, the signals are going to travel directly from my toe through my spine and into my brain and start screaming at me that I have just stubbed my toe.
Now, what's fascinating is we've studied the nervous system for a long time, but only since we've been studying cannabis have we discovered the system in our body called the endocannabinoid system, which every mammal has. We have had in our body for a long time. And I tend to look at the endocannabinoid system as a very interesting system where this is the part of the body that helps regulate pain, anxiety, memory, appetite, inflammation. When your body says, "Houston, we have a problem," the question is, what does your body do about it? And what we found out is the body handed it to the endocannabinoid system to really help put us back into a state of balance, in a state of homeostasis.
Absolutely. So our body is always trying to reach that state of homeostasis, that state of balance. So if we have a pain response, our body is going to react to that pain response, partly by sending different chemical transmitters throughout the body. And part of that chemical system is the endocannabinoid system. And so our body is sending cannabinoids throughout the body to deal with those different signals.
Right. And the reason that that's such a big deal is that when your body tries to stay in balance, and again, that's called homeostasis, your body produces endocannabinoids. And so we know that that's how your body manages itself. And we also found out that phytocannabinoids, the cannabinoids produced by the cannabis plant, mimic the phytoendocannabinoids in your body and then actually help with those receptors. If your body, for example, I'll take myself as a senior citizen, if I'm not producing as many endocannabinoids as I did when I was younger, or if it takes a while for me to produce them, having some phytocannabinoids in my body helps my body do its job.
Absolutely. So you have to think of the endocannabinoid system. Endo means inside. So this is what's naturally occurring in our body already. And then phytocannabinoids, such as from the cannabis plant, are going to be supplementing that system and that process that our body already has.
Right. And it's interesting that the endocannabinoid system communicates with the nervous system to keep all of these factors in balance. And this was a major breakthrough. It was a major breakthrough to understanding how cannabis helps both not only just anxiety and stress, but how cannabis helps with the body, but also how the body manages itself. Again, this is something that's come up really in the last 20 or 30 years because cannabis is made up of three components of cannabinoids, terpenes, and flavonoids. Amy, what are those?
Sure. So these are going to be the three main components of the cannabis plant. So cannabinoids are going to be the most prevalent compound, and there's a couple that most people are familiar with. That would be THC and CBD. Those are the big ones. And then you have the terpenes. This is what's going to give the cannabis plant its smell and its taste. And then a lot of the beneficial effects of the cannabis plant are actually coming from these terpenes. And then you have the addition of flavonoids. So this is, again, a naturally occurring part of the plant. And this is going to also contribute to smell, taste, and the color of the plant as well. And flavonoids can also provide some anti-inflammatory, antioxidant properties to the cannabis plant.
Right. And all three of these working together, it's interesting that when you have all three of these components of the cannabis plant working together, it creates something called the entourage effect, where the one and one essentially is three, or one and one is actually five, where these effects actually enhance the medical efficacy of the cannabis plant.
Yes, absolutely. So when you put terpenes with cannabinoids, with flavonoids, you have a great synergistic effect between all of those different components.
Right. And it's you can see examples of that. I know one of the examples is if you're trying to dose or if you're taking cannabis and you're worried about getting too high from the THC, if you take an equal amount of CBD, it helps to lessen that psychoactive effect. And this is where the CBD and the THC work together to be able to really help your body stay in balance.
Absolutely. And I always tell, especially new patients, THC and CBD, they work better together just to enhance the medical benefits of each other.
Right. And of course, terpenes really are the key for the medical value that's out there. And again, all working together really help. The question is, does it really work? And I know there's been a lot of research that's out there. And one of the studies says that many of the terpenes in cannabis have anti-anxiety effects. And we've seen that in a number of research studies that are out there.
Absolutely. So when we're looking at individual terpenes, which again are what give cannabis its smell and its taste, generally we're looking at what those terpenes are doing for us. There are specific terpenes that have been shown to provide great anti-anxiety or anxiolytic effects. However, this is still a growing research field. So we always need more research, but this is what we know so far.
Sure. And a lot of folks studying or suffering or looking for relief from PTS or chronic pain have also found that cannabis has helped quite a bit. Again, that anxiety-related symptoms when using medical cannabis has really helped quite a bit. There's been other studies out there that show the importance of the endocannabinoid system.
Absolutely. So when we look at keeping our body in homeostasis, in that nice balance, this is where the endocannabinoid system really comes in. It's playing a role in regulating anxiety, fear, and our behavioral responses to stressful stimuli.
Right. And there was a recent 2020 study that showed how one of the endocannabinoids, 2-AG, has really been able to help a lot with anxiety-inducing connections between really with functions going on in our brain. Again, this is being very well studied, and there's not a lot of research that's out there. We kind of know now that research is really proven that anxiety and stress can be addressed by cannabis. And I should point out, most of those studies are done outside of the United States because here in the United States, it's a Schedule I drug. So these studies are coming from Israel, they're coming from Canada, they're coming from Europe mainly.
Absolutely. And the US, until they change their federal drug policy, that's kind of the way it's going to remain.
Right. But I think it's important to point out if an apple falls to the ground in Israel or in Canada, it'll fall to the ground here in the United States. So we know the research actually works. So, Amy, when you take a look at CBD and THC with respect to anxiety and stress, it's interesting the amount of, for example, THC that you take is a real factor. In lower amounts, it really works. And when you take too much of it, it actually causes the opposite effect.
Absolutely. It's what's called a paradoxical effect. And it means that the expected outcome is not necessarily what happens. And I usually let patients know that this is very, very dose related.
Mhm.
So I'm sure a lot of people have heard the trope that sativa flower causes anxiety. I usually try and tell patients that's not necessarily the case. It's usually going to be a dose related issue.
Right.
Because if you do find a low dose that's giving you the effects that you want without unwanted side effects, you found your sweet spot. That might be a low dose, and that's
Right.
okay.
Right. And really, in this particular case, more is not better, especially with THC. There's a point at which THC, you get to that, you say that therapeutic level of relief. And if you take a little bit more, it actually worsens it. And you really want to back down. And finding that particular therapeutic level is really, really important. And that's really kind of the opposite of what happens with CBD, because if you take more higher doses of CBD, that will actually help reduce anxiety. So, Amy, when it comes to anxiety and stress and looking at CBD and THC, higher doses of THC really can help reduce anxiety in lower doses. But when you get to higher doses, it can actually have the opposite effect. I think this is a case where more is not necessarily better.
Yeah, and I would absolutely agree with you. At a low dose, THC can absolutely help reduce anxiety. But a lot of patients find as they are increasing their dose of THC, especially if you're using a product like flour and you're not controlling your dose necessarily as closely as if you're using a product like a tincture or an edible, you can absolutely have that THC induced anxiety. It's just something that happens to some people at higher doses.
Right. And you really got to be careful of edibles because a lot of edibles on the market today are almost all THC. And so when you take, if you're taking some THC, hopefully to try to address your anxiety, you should really cut that an edible in half initially, start low and go slow because you don't want to have the opposite effect happen.
Certainly. And we actually recommend patients usually cut their edibles in quarters to start at a very low dose and then gradually work up to a dose that's providing the relief that they're looking for without unwanted side effects. And that unwanted side effect could be anxiety, it could be feeling stoned or heady, it can just be feeling uncomfortable. We don't want them to get to that point. And so a low dose product is usually the way to go, and it's definitely the way to start.
Yeah, and we know that you need some THC to be able to address the anxiety and that you have in your body. Now, CBD is just the opposite. More CBD will actually help reduce anxiety.
Yes, and this is an interesting thing with CBD. Because there are no psychoactive effects, you can take a larger dose without the worry of it causing anxiety.
Mm-hmm. It's really there. So when you take a look at cannabis as a product or as something that you can look from a medicine standpoint, I tend to look at cannabis as being a whole medicine cabinet. There's 450 medical properties that we found in cannabis, 120 cannabinoids that we know of, although that they're being studied, and 100 terpenes that are being studied. Again, all of those bring that entourage effect back to be able to help you have all those work together to help you address your particular situation, in this case, anxiety and stress.
Absolutely. And we are still just learning more about this plant every day, and I'm excited for more research to come down about it.
Right. And it really is a whole medicine cabinet. I don't think there's any other product out there or any other plant out there that has the medical benefits of cannabis. We talk about CBD. CBD is fascinating in that it addresses both CBD and THC address the CB1 and CB2 receptors. This is for immune system, our peripheral organs, inflammation, immune system. But we also found that CBD has a lot more properties than just that.
Absolutely. And the really neat thing about CBD is that it actually communicates and connects with other receptors in the body, including the 5-HT receptor, which is responsible for your serotonin. And then you have your A2A, which is part of your body's inflammation and coronary circulation responses. VR1, which helps regulate your body temperature and your pain responses. And then your GRP55, which helps regulate blood pressure. And when you have CBD interacting with all of these things, it's helping, again, to bring your body back into that state of homeostasis.
Right. And again, as we get older, we don't necessarily produce enough cannabinoids to give your body the resources it needs to address your anxiety, for example. Or it takes a while for it to be produced, and which is something where you need the question is for quick response, what are we going to do? Now, one of the questions everybody has is, I've got anti-anxiety medication. Will it conflict with cannabis?
Yeah, so the recommendation that I always give is anytime you start a new medication, and that does include medical marijuana, that you're open and honest with your physician about all of the medications that you're taking. That way they're going to have a complete picture of all of the products that you're taking and that are going into your body and how they might react.
But I think overall, you can pretty much say that cannabis really isn't going to have a negative effect when using it with other medications. But in many cases, what you want to do is cut down the other medications that you're using. Don't stop cold turkey, but kind of you can hopefully see yourself weaning off of them.
Yes, and that should always be done under the direction and care of a healthcare practitioner. Anytime that you're thinking about reducing or stopping a medication, you always need to let your doctor know. For the most part, cannabis is very safe with other medications. There are only a couple of medications that it may interact with, and those are actually blood pressure or platelet medications. So very specific. I would usually recommend that when a patient is starting a new product, say if they're using Xanax or Ambien, that they want to start at an extremely low dose of medical marijuana, and then see how their body is reacting with both of those substances together.
Right. And there's many people that do take those medications and cannabis, but again, it's to go low and go slow to make sure that your body not only can adjust to it, but you're getting the right levels of medication to address your particular situation.
Absolutely.
Now, you talked earlier about CBD and THC or Delta 9. Tell me a little bit about the characteristics of those products,
Sure.
or those
So-
cannabinoids.
Sure. So CBD is the non-psychoactive part of the cannabis plant. It is found in cannabis, it is found in hemp, and it is non-psychoactive. It mainly targets the CB2 receptors. However, we just talked about all of the other receptors that it connects to as well.
Mhm.
And this is kind of different from THC or Delta 9 THC. This is also found in the cannabis plant, and it can only be found in hemp in quantities of less than 0.3%. The big
In fact,
thing
I think the
with,
definition of hemp is a product that has 0.3% THC or less.
yes, exactly. And then the big thing with THC is it is psychoactive, so it may produce psychoactive effects for the patient. Now, the primary receptor that THC interacts with is the CB1 receptor, but it can have some interactions with other receptors as well.
And that CB1 receptor is primarily in the brain and in the central nervous system, hence why it can generate or can cause a psychoactive response to that. But we talked earlier about cannabinoids working together, and we talked about the entourage effect. This is a pretty good example of where you can take, for example, if you look at just pain, and you can see where the different receptors, different cannabinoids working together can be able to help address things like pain, sleep, inflammation, and cancer. This is a pretty good example of that, where everything working together, 1 and 1 is really 3.
Absolutely. And especially when you consider minor cannabinoids, so cannabinoids that might not appear in such large quantities as CBD or THC, these minor cannabinoids have a very powerful effect on the body. And even in small quantities, they're still very effective.
Right. And, it's not necessarily how much, it's the fact that it's there that makes a big difference, that really helps quite a bit. We talked earlier about how terpenes really are the key to the medical properties of cannabis. And these are some examples of terpenes and how they can help with anxiety and stress.
Absolutely. So, I mean, you'll have the really popular ones like limonene, pinene, linalool, and myrcene. These all have the ability to help relieve stress and anxiety. Another really big one is beta carotene. Um, all of those terpenes are going to be major terpenes. So they usually appear in larger quantities than some of the minor terpenes. So
Mhm.
these are the real powerhouses of the terpenes.
And I think when you're looking for a cannabis product to address anxiety and stress, one of the things you should ask the dispensary, the person people that you're working with is, what are the quantities of these particular terpenes? Look for these terpenes to address anxiety and stress. I know I've talked to patients that say, well, I tried cannabis and it didn't work. Well, when I go back and look at the product and I match it against their particular condition, sometimes the symptoms and what they're trying to address doesn't match up with the benefits of the terpene.
Absolutely. And this is why asking the person who is helping you at the counter, asking them for a certificate of analysis or a COA can be very helpful because that's going to give you the specific breakdown of terpenes in that specific product.
Sure. And that's how it's kind of interesting. When I first got into medical cannabis, I would go into the dispensary and I would see a lot of different products. And I was wondering how that person knew what would work for me. And it was because they were matching the terpene profile to my particular condition. Now, terpenes are interesting in that they are very sensitive to heat. And I say that because there's a lot of folks that'll say, well, I'll just smoke a joint and it'll take care of it. And what's fascinating is when you put that 500-degree temperature up to a joint, you're burning off half of the cannabinoids, almost all the terpenes and all the flavonoids. It's key to be able to have a product, especially if you're looking at a vape type product, that has a temperature setting so that you can set the appropriate temperature for the targeted terpenes that you're looking for.
Absolutely. And this is really going to take some trial and error to figure out what temperature range best works for the conditions that you're trying to treat.
Mhm.
But I always recommend starting at medium. And then if you need to go higher or lower, you can do that. But medium is going to give you a good access to all of the available cannabinoids, but it's going to give you access to a lot of the terpenes as well.
And I think it's important to point out that if you have a vape pen that has a temperature setting that could be low, medium, and high, or some of them actually have 4 temperature settings, that you say that one that keeps it in the range that's below 350, the first setting or the second setting is really the ones that you're really looking for anxiety and stress. When you take a look at terpenes in other products, they actually have a terpene profile where they've been produced at those temperature ranges to bring the benefits out of those particular terpenes.
Absolutely. And this also applies not just to vapes in the classical sense, which you would see like cannabis oil connected to a battery and you have a vape. This can also work when you're using what's called a dry herb vape as well,
Mhm.
which is a product that you would use with flour.
Right, right. And it's very, very important. Let's talk about the different cultivars. Now, what is a cultivar? What's happened in the last 5 or 6 years is a lot of the people that are producing cannabis are starting to produce products that really target particular conditions. And when you take a look at the terpene profile and the strains together targeting a condition, they call that a cultivar. And we used to use the word strains quite a bit, but really it's more than just strains. It's the strains and the terpenes together that produce the profile that's out there. So if you take a look at some of the cultivars that address anxiety and stress, you'll see a very, very common terpene profile that with myrcene, pinene, caryophyllene, limonene, that type of thing.
Absolutely. And once you know what terpenes you want to use or what terpenes you want to be the majority of the product that you're using, then you can start looking at THC content.
Mhm.
Like some of these are CBD dominant, or they're a balance of THC and CBD, which can be really great for newer patients. If they're worried about getting that high heady feeling, using a balanced or a CBD dominant strain can be really beneficial.
Now, I've highlighted pinene here, and the reason for that is pinene is really great for anxiety and stress. However, pinene also brings back short-term memory. And I know if you're one of your conditions that you're trying to address is PTS, you really want to pay attention to pinene because that may cause the opposite effect of what you want to have happen. Let's talk about how to take the product because we touched on it just shortly a little while ago. One of the ways people start is with sublinguals, and again, be very careful because there's a lot of sublingual drops out on the market today that don't have terpene profile.
Yes, and this is why it's really important to get your medication from a trusted dispensary, and they should be able to provide you with that COA, that certificate of analysis, that's
Mhm.
showing you exactly what the terpene profile is for that particular product.
Yeah, and one of my favorite dispensaries, which is Surterra Wellness, they'll actually tell you the actual terpenes that are in their sublingual drops. And I know that when my wife was trying to take some of the sublingual drops, we were addressing her anxiety and stress. We tried another dispensary that did not have any terpenes in their sublingual drops and didn't work for her. And we found that by being able to find the right, not only the right tincture drops, but the right terpene profile made a huge difference. It really brought her the relief she was looking for.
Absolutely, and that is part of the journey, is finding that specific product that works really well for you.
Right. And these sublingual drops and sprays, they usually take 15 to 20 minutes to work, and they'll last anywhere from 4 to 6 hours. So it's something, for example, when I wake up in the morning, I'm addressing pain, I'm addressing inflammation, which can bring anxiety and stress in higher levels. I tend to use a sublingual drop in the morning to really take me through the morning, and then I use sublingual drops in the afternoon to be able to take me through the afternoon. Then I do it again in the evening because, again, I have that 6 hours, 6 hours, and 6 hours. My herniated discs in my neck aren't going to go away. So I've got to address them during the day to be able to keep them in check and keep them with a pain level below a 1. And that's really, really important, is how often you take it. And sublinguals are kind of interesting because they really absorb into the blood vessels of your mouth. But a lot of folks you hear about edibles and capsules. It's a very big difference because in edibles and capsules, they take anywhere between 15 minutes to 2 hours to work, but they will last up to 10 hours. And that's really an important aspect, especially in the evenings when you want to sleep through the night. Something where like a gummy in the evening will help you sleep through the night, where a sublingual may not.
Absolutely. And having a little bit longer onset time for those products, you always just want to be careful that you're waiting long enough before you take any more.
Right. I mean, there's a famous saying that about the time you think it's not working is the time it starts working. And I always what I like is because, again, I'm trying to address, in my case, herniated disc. Topicals work great, especially transdermal topicals.
Absolutely. And the nice thing about most topicals on the market is that they're going to be just localized relief to wherever you put it. So you wake up, your knee hurts, put some on your knee. It's only going to help your knee, and it's not going to give you that high, heady feeling or any systemic effect throughout your body. It's just going to be localized to wherever you put it.
Yeah, and when you rub on the topicals, they last a couple of hours. Although there are patches that are out there that'll last sometimes up to 3 days. It depends on the product itself. It does what they call microdosing. It lets a little bit of cannabis out as you go during the day, and that's very, very effective. Now let's talk about inhalation for a second, because this is what we talked about earlier. Flower, is very effective, but again, if you try to burn off all the medical properties of it, it doesn't help very much, and that's why they talk about vape pens and concentrates.
Absolutely. And like we said before, really look into, if flower is something you want to use, look into a dry herb vape. It's just going to give you a lot more control over the temperature and really how much product you're using, because you're controlling the temperature so closely.
Yeah, and you can get a lot of those products from the dispensary themselves. They carry a number of different products that are out there, and I highly recommend that you invest in one, because the relief that you get is tremendous. It makes a big difference. And again, also take a look at potentially mixing, matching the sublinguals, the oral, the topical, and the inhalation based on what you wanted to cover during the day. I know I just finished doing some serious physical exercise, meaning called moving, and the topicals became a very important part of my life at that point in time. So let's talk a little bit about wrapping this up. We have talked about anxiety and stress. We've talked about how medical cannabis can help. I also want to point out there's a website called igmlb.com, igotmylifeback.com, that if you have a medical cannabis story, please go there and share it with us. We'd like to have folks be able to hear about your journey that's out there. And more importantly, what we're trying to do is build a library where you can actually see the effects that people have had using cannabis, not from the scientists, but from people that are actually users that are out there. So that's kind of an important site that's out there. But Amy, let's wrap up a little bit. What's your thoughts on anxiety and stress to wrap up?
So my biggest thing is, of course, start low, go slow. And I really recommend incorporating both CBD and low levels of THC if you're trying to focus on anxiety.
Right. And I think also paying attention to your route of administration is really important, because matching the terpene profile to your particular condition makes a huge difference with cannabis. And I think that's important to make sure you're looking for those myrcene, those linolols, those limonene. They'll help you quite a bit. Those beta-caryophyllene, that'll make a big difference in what's there. So Amy, as a wrap up, we know we have this webinar series that we put together, and a series of videos on YouTube that you can learn about how cannabis can help you in general, as well as with your medical conditions. But also, we have the marijuana aware webinars on a weekly basis are something that people can tune into and get their questions answered as well.
Absolutely. And it's a great resource to help you find the products and learn more about the products that can potentially help you.
Right. Well, we hope that this video has helped you address anxiety and stress. Please join us for our webinars, or check us out on social media, our YouTube channel, as well as Facebook. If you have any questions or comments, please email us at events@marijuanaaware.com. Thank you very much for watching, and we look forward to your comments. There's a lot of theories about it. Let's talk about actual products that you can get that can help you today. Zach and Taylor, do you want to take us through some of the Surterra products that we have out there? Because this is something we can go to a dispensary today and purchase, right?
Absolutely. To our knowledge, all of that product should be in stock for at least every location that we have.
Right. Well, tell us about them.
Absolutely. So these products were actually my recommendations based on my experience with anxiety, PTSD, OCD, and my journey with cannabis. So the first product that I recommended was Soothe. Now, Soothe is one of our 1-to-1 ratios, which means it's 1 part CBD, 1 part THC. The reason that I like Soothe so much is it is a product that allows me to slow down in my head and in my body without feeling any euphoric feeling because of that 1-to-1 balance. As we talked about in the video, they kind of cancel each other out a little bit, right? So with Soothe, it's not going to be too energizing, but it's also not going to be too heavy. Now, that's not to say that it's going to be that way for everybody. As I talked about again, it's different for every single person. Everybody's chemistry, the way they metabolize it, the way they absorb it into their system, it's going to be different for every single person. So as with your journey, always start low and go slow, but Soothe is a great product to start with for people wanting to get into anxiety relief without feeling too euphoric.
And what I want to point out, and what I really like about the Surterra products is, if you look down over here, there's more than one route of administration that you can use Soothe and get the terpene profile. Look at the terpene profile of this product versus what we were talking about for anxiety and stress. It's a very good match, but it comes in a number of different forms, both vape pens, tinctures, concentrates, capsules, gummies, which is great, and patches. You don't find a lot of gummies that have the 1-to-1 ratio and have the terpene profile. That's very unique in the market. That's safe to say?
Absolutely. I would say so. We hear a lot of patients that tell us that there's not a lot of that ratio-based products out there in the dispensaries. So people do really rely on Surterra Wellness to be able to provide that for them and to be able to speak to it. You know, what we're talking about is our experience with it and being able to have it in multiple forms, because everybody's journey is different, whether they want to do inhalation or they'd rather do an oral product, or like you said, an edible, which is always a good place to start. So it is awesome that we were able to provide such an awesome product in a variety of routes.
Yeah, and my recommendation to a lot of patients that I work with is use a route of administration that you'll use. If you're not into inhalation, don't get an inhalation pen. Get something that you'll use. If you are into it, then head in that direction. Make it a comfortable journey and something that's very natural for you, and I think that's important. And again, I want to compliment Surterra for having the terpene profiles. Again, this is not only unique, but I think really takes on a really good accent that you are focused on the medical part of medical cannabis and doing a lot to be able to provide this product. Tell me about Revive, because I use Revive.
Yes, Revive is my second favorite 1-to-1 ratio as well. What I would describe Revive and the difference between that and Soothe is Revive is definitely more energizing, and it doesn't really focus on your body as much. So it is going to be mainly used for promoting energy and focus, hopefully reducing anxiety. But the cool thing about Revive, as it was spoken to, with that high level of pinene, which is my favorite terpene, it is fantastic for memory retention, and it also helps with airflow to the lungs. And that can kind of determine what route you'd like to take that in. People that would rather have that airflow to the lungs might choose a vape pen because it's going to be absorbed in differently than a Theragel could be, or a capsule, whatever terminology is used for that. But Revive is going to be more of an energizing product without feeling any kind of relief, or mostly not feeling any relief in your body. With that being said, it can cause a little bit of anxiety for some people. So, trying to do it in a vape pen, if you're interested in that, is a great starting method to see if that is a ratio and terpene profile that works for you.
Sure. Now, your other products, I know you have, you've mentioned like Lemon Zest and Libra Sun and Clementine. I also think your Mango Peach Mints are very cool.
Yes, I enjoy the peach mango mints flavor the best out of all of them, to be honest. But what I like the most about them is they are only 2.5 milligrams of straight THC, which is a very recommended dose for microdosing during the day. With it being a sublingual product, as a normal mint would be, it's going to absorb in through your cheeks a little bit, but it's going to go through your digestive system, making it an oral product. So it kicks in about 45 minutes to an hour, and it lasts about 6 to 8 hour duration. But you're able to kind of go at your own pace with those mints being only 2.5. So for a lot of people, it just helps take that quick edge off if they're feeling a lot in a moment. A mint like that can just kind of calm them back down. It's not going to be too euphoric with that lower dose, but again, everybody is different.
Sure, that's really there. Well, I think it's a great set of products. And again, look at your terpene profile at the bottom. Your limonene, your pinenes, your caryophyllines, and your linalols. That's kind of your how should I say, your all-star set of players for addressing anxiety and stress.
Absolutely. Yes, 100% agree. Pinene, again, fantastic one. Limonene is definitely they're all good. They're all great. I can't really speak to one. They're all fantastic.
Right. But I think the key is there are products, first of all. Number two, they are all, I should say all, most of them have a very high and a very detailed terpene profile, which is really, really key. And they're all available to you. I think that's really the key to really understanding this particular slide. Now, anything else you want to add, Taylor or Zach? All right. Well, then if that's the case, let's jump into some questions and figure out that's out there. One of the questions is Delta 9 makes me jumpy, and I think it raises my blood pressure. Is a blend or Delta 8 better? Pain and inflammation need help or help needed. Do you want to take that one on, Taylor?
I can try my best. Absolutely. I see that this question was submitted from Alabama, which is not a medical state to my knowledge. So with Delta 9, it's going to be a little bit difficult to try to manage that because it is going to be not as terpene rich or as high in THC as some other products could be, right? But with that being said, the Delta 9 THC can definitely raise your blood pressure. A lot of people feel like sativas, as it was described, are a little bit more inducing in that anxiety, and THC, as we discussed, in higher doses can be a little bit inducing for that. A blend is always a good choice, whether you're trying to do more of a hybrid or even but if you're able to get another CBD, that is definitely a great alternative to that to help bring that THC high down a little bit.
Right. And I think it's important that we talk about dosing going low and going slow. Just don't jump into Delta 9. Pay attention to THC. Pay attention to having really a 1-to-1 and finding out what your tolerance is, and then being able to, once you find that out, increase the amount of CBD. When you talk about ratio products, you talk about, for example, a 4-to-1, the first number is CBD, the second number is THC. So you have 4 parts CBD to 1 part THC. That's really important to find out what that mix is, because that'll help you quite a bit. Let's go to the second one. What are the best terpenes for anxiety and panic attacks, and how do they work? This really goes back to, and I'm in 4 weeks we have a whole webinar on dosing, and I really highly recommend anyone interested in this to join us for that. Every person's body is different, and just like alcohol and just like caffeine, everybody will react differently. Some people have one drink and they're done for the night, and some people drink the whole bottle and they're just getting started. The same thing applies to cannabis, but we do know that there are terpenes that address anxiety and stress. We do know that they work. Why don't you give us that short list? Because I think we detailed them earlier in some of the slides that we've had.
100%. So the best one that I would say to start with would be caryophyllene, or there's one way to pronounce it. So with caryophyllene, it's not going to be the first priority. It's not going to be reducing anxiety. It's actually going to be better for promoting or helping with inflammation and discomfort. So with that, as anxiety is like a secondary, that's a great way to kind of start it out a little bit. So you're able to get relief of that anxiety, but without it being too much for some people. A terpene like limonene can be a little more inducing in that anxiety, because it's, focused on creating better space for energy, helping you focus, but also reducing anxiety. But sometimes it can counteract with that. So I would say for anxiety and panic attacks, my recommendation would be something to start with a higher level of caryophyllene, possibly next being limonene, possibly next being myrcene, to kind of balance out that head focus and body focus terpenes.
Mm-hmm. Right. Now, there's one other question that came up about a terpene that increases anxiety. I'm not really aware of a lot that increase anxiety, but I do know you have to pay attention to pinene, mainly because of, again, it brings back short-term memory, which could or could not be an issue with respect to patients that are looking at addressing PTS. Your thoughts, Taylor?
I completely agree with that. There's a lot of terpenes a lot of them work together, and some of them work against each other a little bit. For example, with that third question, that is a terpene that is not predominantly found in a lot of cannabis strains. However, it is still in there, and it's mostly paired with limonene, which is why that specific terpene can enhance someone's anxiety, because it's mostly found with limonene. Same thing with pinene. Bringing those memories back for a lot of people can be a little bit inducing of stress and anxiety, but having that good balance of myrcene, caryophyllene, it definitely can help balance that out a little bit, if that answers the question.
Yeah. Now, one of the questions that came up is, what's the best ratio of CBD to THC for severe anxiety? I've tried 5-to-1, 1-to-1. My wife has an issue related to anxiety and stress, and she takes either 12-to-1 or 20-to-1 product. Don't give up at 5-to-1. The CBD products from 12-to-1, for example, and 20-to-1 work very well for her. At 5-to-1, it really wasn't working that well for you. It goes back to that whole dosing issue of really, what does your body really work with, and what does it really need? Your thoughts, Taylor?
Absolutely. Like, everybody's body is going to react to it different. So again, you can have what works for you could be a higher ratio of CBD versus a higher ratio of THC. Everyone's going to be different. So if somebody has had the journey of trying a CBD ratio and kind of dwindling that down to having a higher THC ratio, I wouldn't go higher than maybe a 1-to-4 or a 1-to-5 with, predominantly being THC, because once you get higher to that point, you're now in a higher THC ratio, which can possibly be a little bit more crazier for people with anxiety. So, and with that being said, I'm a big sativa person. I really enjoy it. But I like having that balance with my ratios that way. So, if 1-to-1 isn't helping, you can try, depending on the dose that you're taking, or specifically the ratio in there. So honestly, either end could work for you. It's just a journey that you'd have to go on, and being able to jot down what works and what doesn't.
Sure. And you mentioned something really key when you're dosing is really journaling. Keep a journal of what works for you. It's something that, again, you go low and go slow. Your body will tell you if you're getting relief. Just listen to your body. I know a lot of people say, "Gee, Mark, what should my ratios be? What should my dosing be?" Same thing with doctors. What should you do? In this particular case, I tell them to listen to their body. Their body, you'll know when you feel better. And you'll know when you've reached that level of therapeutic relief. And you'll know when you go past it, you don't feel as well. Just back down. Your body will tell you. And that's what's really key. No doctor and no practitioner is going to tell you as well as your body's going to do that. It's just a sidebar. Keef, will Keef help with anxiety? And you might mention, Taylor, not a lot of people know what Keef is. You want to tell them what it is?
100%. Yeah. Keef is going to be essentially that powdery stuff that falls off the flower when it's grounded up, or when you touch it and you get that little bit of dust on your fingers. That's keef. Keef is the trichomes on the flower. So keef is going to be what.
And that's really where a lot of the medical value comes into play.
Yeah, I was just about to say, with trichomes, that is what's holding your cannabinoids, your terpenes, all that stuff is found in the trichomes. So with keef specifically as an isolated item, it can be good for anxiety depending on the strain, but I would stick with more of a hybrid or hybrid leaning sativa, because the THC is going to be a little bit higher than your typical flower, because it's just going to be what all holds those cannabinoids and terpenes in them. Strains specifically that I would recommend at Surterra, Kaliwana is a great hybrid that's not too up or too down. I think that's a great middle place to start, especially if you're going to be adding it either to flower or vaping it on its own, because again, it is a little bit higher in that terpene profile. So Kaliwana, any balanced hybrid. I, in my previous slide, said lemon zest. I'm a big fan of lemon zest. It is labeled as a hybrid. In my experience, it feels more of a hybrid sativa, but the terpene profile on that one is going to go caryophyllene, then pinene, and then limonene. And because of that balance, it helps be a little bit of an anxiety relief without being too crazy or too energizing. So again, to answer the question, predominantly keef is going to be a higher content of cannabinoids and terpenes. So with that being said, any strains would be same as a flower strain. It's just going to fall off the flower anyway. So whatever flower strains work for you, that keef might work for you as well.
Right. One really good question is, can medical marijuana help me reduce mild to medium anxiety without significantly altering my mental state? I will mention that this is the issue that my wife faces. And the answer is yes, it has worked for her. Now, I do have to tell you, we did go through a journey to be able to find really the right products for her, to find her therapeutic level of relief and to find the right CBD THC ratio. I think what threw us a little bit was she needed a lot more CBD than just the 1-to-1, 4-to-1, 5-to-1. She needed more of the 12, 20-to-1. But I think the answer is yes. Is that a fair assessment, Zach and Taylor?
I believe so. I think, in my experience, it definitely has significantly helped my mental state, but it's also paying attention to the way you chose to use it. If you intend to use it in a way that is not going to be beneficial in the medical sense, it might not help your mental state, because again, you're going at it in a way that's not going to benefit you. And I think everybody's mental state is going to be different. And that, to really answer the question, I do believe it helps 100%, but it also depends on where your mental state is when using that medical cannabis.
Right. Well, you also have to, and again, in sports, they say you've got to trust your swing. You got to trust your body. Let your body do the work. It'll tell you. Don't be afraid to use this. No one has ever died from using cannabis, either recreationally or medically. It's safe. It's safer than McDonald's hamburgers. It's safer than peanuts. Okay. But I think it's something that you really have to be able to get in the right frame of mind to be able to really, I think you brought up a good point, to really be able to use it effectively. One other question is, does marijuana affect anxiety in the long run? I think it can affect it positively. Your thoughts?
My thoughts would be it definitely can. I think it could go both ways. Again, it depends on the reason for using that. And marijuana has such a great benefit for anxiety. A lot of people deal with it socially, deal with PTSD, whatever the case may be. Marijuana can help take that edge off, which is what a lot of people feel with that anxiety. Can it help in the long run? 100%. But it also can be a journey that hasn't worked for everybody. This could be products that you try to help with your anxiety and it's only made you worse. So that people are a little bit more hesitant to try other products or to get back into the marijuana because they've had negative associations with it. Right. As we've all said several times, it is a journey. Let your body figure out what works for them. Keeping a journal, having as much information as you can, and talking to your bud tenders is a great way to get some information on that.
And going slow is the way to approach it. I mean, I wish I'd have known that when I was in college and discovering alcohol. That was something I probably should have paid attention to. But with cannabis, it's something that you will, if you follow that particular formula or that particular process, you will find the relief that you need without a lot of difficulty. One other question comes up about using indica at night to help sleep that could intensify emotions. Again, that's an individual thing, but I tend to use an indica in the evenings to sleep. I think it's important. Your thoughts?
My thoughts would be indicas are great for sleeping, and I have heard people feel that more anxious at night with using an indica product. Now, two different reasons this could happen. One, your body just happens to react that way with indicas. Some people do almost react opposite, as the slideshow was talking about. Sativas might be a little bit more heavier in the body, and you might feel better for sleep, while indicas are a bit more energizing, and you feel like your head's going a bunch of different places. So that could be one reason to it. Another thing I would recommend would be understanding the product that you're using. If it's always going to be flower or only going to be flower, that might cause more of a stress-inducing experience just because of the route of administration that you're using. So you can always try to go for an edible to help your body stay asleep for 6 to 8 hours without it being too inducing for your mind. So that'd be one way that you could try to relieve that. But also as well, trying products that have that CBD in them, or CBN or CBG products that still able to help you with sleep when that's needed, but not to be too racy with that. So again, it's a journey. Trying different routes might be beneficial for that incident, but it also could just be your body reacting to it in a way that's not, helpful for you, unfortunately.
Yeah, and I should mention next week's webinar is on sleep and insomnia, and we have a sleep expert, Dr. Greg Holt, joining us. So if sleep's an issue for you, please join us. Pre-submitted questions. Again, I have an excessive or intrusive thinking associated with my anxiety and PTS. Is there anything that works for that? I think we've addressed that a couple of times, and I think the answer is probably yes. Your thoughts?
I actually I've diagnosed OCD, so I'm also dealing with excessive intrusive thoughts, overthinking, just constantly in that cycle. I am prescribed medication that does help me, and I use the medical marijuana to, again, kind of bring that anxiety down a little bit. So is there anything that can work for that? Absolutely. There's so much out there that could potentially work for that. It's just depending on what journey you're willing to take with that. In my experience, I have had better incidences with hybrids out of, sativa, indica. Hybrids seem to be the best for me in my situation without being too energizing, and again, without trying to be too sleepy, because I need to get my stuff done, but I don't want to be dealing with all the craziness going on in my head. You know what I mean?
Right. One of the other questions that's come up, which is a great question, and for the person here in Alabama, is can you get help with medical marijuana in any state? First of all, obviously programs like this are not geographically restricted. We provide information across the entire nation, including Alabama. Now, the problem is that here in the United States, cannabis, marijuana is still a Schedule I drug federally. So it really leaves it up to each of the different states to be able to put together a medical marijuana program. Now, I do know that in Alabama, they passed a medical marijuana program in 2021. However, a lot of states, the people of the states vote for these programs, but the politicians slow move this thing and take forever to implement it because they really don't want it. This is that conflict between what ruling politicians want and what the people want. And I'm not trying to pick on Alabama or any other state. I know here in the state of Florida, it took us 4 years to get a definition of edibles put out there, although they were approved right up front. So it's one of those processes that unfortunately we're going through because we're still in a prohibitive state. And I think the help you can get is going online, like you're seeing with web seminars like this. Within the state of Alabama, I'm not aware of a lot of assistance because the program really hasn't been, the guidelines and the process to be able to use medical marijuana, how to get a card, has not been clearly defined. So you're going to have to stay tuned, and I apologize for that, but unfortunately, that's the state of prohibition that we're in right now. And please don't shoot the messenger. We'd love to be able to help you as much as we can. So one of the other questions is, how difficult is it to obtain a card without medical records? My condition is insomnia, back pain, OCD, anxiety, and stress. I think the question really boils down to, if you have any medical records, you don't necessarily need to bring them into the clinic, but you do need to give the clinic the authority or the permission to be able to obtain those records. If you had a doctor be able to look at those particular conditions and be able to say you have, for example, back pain or OCD or something like that. So you do need some sort of a doctor's, let's just say, authentication that you have this particular situation, and be able to give the clinic the capability to be able to get access to those particular records. And I hope that answers that. How do I find a physician? Well, I recommend MMTC of Florida if you're here in Florida, or True Relief MD if you're looking at like Mississippi and Ohio. But also, I think Zach and Taylor, you have a guide on your website to physicians.
Yes, we do. Absolutely. It is Surterra.com, and there's a section on the top that says find a physician based on your location.
Mhm.
Every doctor is going to go through, different processes, but finding one that's best on your location and what your symptoms you're looking for, there's so much information out there on how to find a physician.
Mhm. Right. Great. So that's it's really helpful. One question is, I got my medical marijuana card a week ago and now have a new anxiety. That's very interesting. I'm new to the country and looking for a job, but now I have to worry about drug screening. In certain states, Florida being one of them, drug screening is something that you do have to worry about. People will do drug screening now. I do have to tell you, I worked for 38 years in Silicon Valley. We did not do drug screening. If we did, we wouldn't have any of the high tech companies that would be out there, to be candid with you. And there's a lot of companies here in Florida that are really backing down on the drug screening. I'll take a couple of interesting groups like the NBA, National Basketball Association, the NFL. Those folks are actually backing down. So there's a trend to be able to back down on that, but it is something that you do have to pay attention to, and you really need to ask your prospective employer if that's something that they're looking for. Unfortunately, we haven't got legislation in place to be able to protect you, even if you have a card. And again, that has to do with the politics and not the policy, the program itself. It's the policy. It's more the politics than anything else. So I don't have a good answer for that one, other than stay tuned. We'll see. And again, ask your employer. You'll be shocked at how many employers have stopped doing drug screening. It's really, they don't put out a sign outside that says we don't drug screen, but you'll be shocked at how many employers, as part of their employment process, have stopped doing drug screening. One of the other questions that says is, I tend to use sativa in the daytime for energy and at night indica for sleep. Can sativas trigger anxiety? What do you recommend? Taylor, I think this is right up your alley.
Oh, it sounds like it. And then also with that related question kind of goes in together. So when we look at sativa, hybrid, and indica, that classification is really going to be broken down into the terpene profile, right? It's going to be determined if I have these predominant terpenes, this might seem like more of a sativa flower. Yes, there are characteristics to how the flower is actually grown to kind of determine, is it going to be a bushier flower, a smaller flower, it's going to have more purple. There are indications with that can say this might be more of an indica type of flower, but we don't necessarily look at those to classify that specifically. We want to look at the terpene profile and how it reacts to an individual or several individuals if we're doing a testing about it. Can sativas trigger anxiety? They definitely can, but anything can. And that's kind of what we want to pay attention to, is anything can cause anxiety and can trigger that. Some sativas do seem to be a little bit more energizing in that anxiety aspect, but that's not necessarily to say to scrap all of them, because sativas are very beneficial for fatigue, for memory retention, for focus. There has a lot of benefits to sativas and how the terpene profile works with that. So, we keep going back to it, but it's essentially the terpenes are what's going to make the difference, and how your body receives those terpenes is also going to make the difference for you as an individual.
Yeah, I think the state of medical cannabis has really evolved to the point where I think we now know that the terpene profile is really the key to really providing the relief and paying attention to that. And finding a dispensary that pays attention to terpenes is really, really key, which is why I compliment Surterra Wellness. You guys do a great job of putting it out there and letting people know what you have. Last question that we have on this particular slide is what dosing is recommended. And I have to tell you, we can't recommend something. It really goes back to what your body pays attention to. Join me for my dosing seminar or webinar. It's going to be in about 4 weeks. What you're going to find is that, again, every person's body is different. It has to do with your metabolism, it has to do with your weight, it has to do with your medical condition. And as I mentioned earlier, some people can have one drink and they're done for the night, and other people can drink the whole bottle and they're just getting started. Same with cannabis. If you go low and if you go slow, and if you start with a one-to-one product like a tincture, you'll get to a point where you'll know your therapeutic relief. You'll take a day or two of 0.25 milliliters, then go up to 0.25, then go up to 0.5. You'll find out where your therapeutic relief level is for THC. And once you find out what that is, then you can increase the amount of CBD, the ratio of CBD, and that'll really help you quite a bit. That's what I'd recommend. I can't tell you what it is. I can tell you how to find it. I hope that helps. So, what is known about meditation and medical marijuana, I've noticed an increased relaxing benefits from MMJ with meditation. Absolutely. Taylor, you want to take this? I'll be more than happy to take it if you want to. You want to take this?
I don't know much about meditation when it comes to medical cannabis, but it would make sense that, your body's releasing those endorphins and your body's relaxing on its own with meditation, yoga, whatever that regime may be for you. So that would make sense that it is increasing that relaxation because your body's reacting and receiving those cannabinoids a little bit better when your body's feeling a lot better. You know what I mean? That would be my take on it. But Marc, I'd love to hear your version of it as well.
Well, I have to tell you, I have tried meditation because I have a very active mind. I come from an engineering background and my mind doesn't really turn off very easily. I've tried meditation and it does help to a certain degree. I also got into something crazy. I practice Tai Chi and I'm into the wax on, wax off version of Tai Chi. I'm in Form 3, for example. And I found that when I'm able to do my Tai Chi, I put myself into a meditative state. I find it when I put my body and my mind together, and when I combine it with using medical cannabis, especially indicas, I have found it really relaxes me. In fact, I do my Tai Chi at the end of the day after my work day to basically put me in a very relaxed state. Meditation and cannabis can work very well together. I have a friend of mine who's very big into practicing meditation. She has a whole practice of that. And she actually recommends various forms of medical cannabis to be able to help. I've heard a lot of good things about it. Really haven't heard a lot of negative things about using medical cannabis in meditation. So I think that that's something that, yes, it is known and I would recommend it. And again, if you're the type of person that has trouble just having your mind settle down, do something like yoga, do something like Tai Chi, because you'll find it really, really helps quite a bit. Let's go to the next question. What is the best combination to lower stress and improve focus without becoming sleepy? That's a good question. Again, that goes back to your dosing, right, Taylor?
Yes. With that being said, too, not only is your dosing, your terpenes. Again, that's what we're always going to stick with. A combination that can help you lower stress and improve focus would be pinene. Pinene would be one of those terpenes that I would recommend because it does help with memory retention and it does help with lowering stress because of that, because it can help your focus and your energy levels. That would be also something that doesn't make you too sleepy. But when it comes to the combination of that, because you don't want to induce too much anxiety, right? You want to be able to lower it as well as improve your focus. So having a combination of a hybrid leaning sativa, just based on the classifications and the way that it's broken down at dispensaries is the easier way to find it that way. But again, pinene would be the terpene that I would focus on, with a backup being caryophyllene. So that combination of those two terpenes would probably be the best to not be too sleepy and also to lower stress. So I think that would be the best.
Sure. Now, Taylor, one of the other questions I think we've answered a couple of times, but I think it's good to just mention again is what strains and methods of use for PTS and also strains that differ for PTS versus depression. I think we should not only just talk about strains, I think we need to talk about terpenes, right?
100%. Yeah. There's definitely some strains out there that seem to be better for people that have PTSD. One example would be Jack Herer. Jack Herer is a strain that a lot of people, including myself, felt that they had a relief from that PTSD effects in my body without being too overly focused on that anxiety aspect. That's just for me, but there are people out there that strain doesn't work for them, and that's totally okay. So again, it's going to differ terpene wise and also dispensary wise, because a lot of the ways that dispensaries, especially here in Florida, they might have different profiles of terpenes based on this. We might have the same strain that another dispensary has, but that terpene profile might be a little bit different, you know? So always paying attention to that and asking your bud tender, can I have that COA, or can you tell me what terpenes are in this? I want to stay in this direction, or I want to stay away from this. That would probably be your best route for that one.
Sure.
And then for methods, again, when it comes to dosing, everybody's going to be different based on the duration, and the onset method would be an inhalation product because it kicks in super quick, but it doesn't last super long. So it's only going to be something that kicks in and almost immediately, and it's going to last about 1 to 4 hours, 2 to 6 hours, just depending on what it is. So that would be a method. But again, dosing wise, it's a little different person to person. I hope that answers the question.
Yeah, I think again, it's very personalized. What do you recommend for post-surgical relief? I'll take this one if you want, but Taylor, you want to take a kick at it? This is right up my alley, by the way.
No, absolutely. The only thing I was going to say was a topical, but I know that you've probably had a lot of experience with this, so go crazy.
As a athlete and as a senior citizen, I have the ambiance of 2 knee replacements. Actually, I've had 3. I've had one of them I had to do twice because the first one I had done when I was 44 years old, and I actually wore out the knee joint and had to have it done again when I was almost 70. Post-surgical, I was Jewett Orthopedic here in Orlando. I was their guinea pig for using medical cannabis for post-surgical pain relief as opposed to opioids. When I was in the hospital, I was operated on Monday. I had to take Percocet Monday and Tuesday. Percocet has a lot of negative side effects. On Wednesday, I did not use Percocet, and the definition of pain came up. I was relieved. I was actually released about noon. Now, prior to my surgery, I had worked with my medical marijuana doctor, and I put together a program for what to take when I wake up in the morning, what to take in the middle of the day, what to take in the early evenings. And I forgot to put together a regime for sleeping, but we did after a couple of days and realized that was important. I recommend when I wake up in the morning, I have a vape pen, and the first thing I do is I take 1 or 2 hits off the vape pen. And that's because vape pens will work almost immediately. Takes my pain level from a 7 or an 8 down to a 1. And I know that sounds crazy, but the first time that happens, I said to my wife, this is crazy. It's like somebody took a rag, wiped my back, and the pain went away. And every day it happens. Now, this has been 7 years. And I have to tell you, even today, I was shocked at how well it works. And I augment that vape pen with a tincture drops. And the reason I augment it with the tincture drops is because the tincture drops will take, for me, about 25 minutes of work, but I want to get rid of that pain almost immediately when I wake up. And the tincture drops will carry me into the early afternoon. Then in the early afternoon, again, I use another set of the tincture drops. This is where I come into that Revive product and use that in the afternoons because it helps me be able to stay energized during the day and to be able to control my pain. And then again, I always carry a vape pen with me because you never know when you're going to hit a curb, bang something, hit something. And that, again, gives me that instant pain relief that I need. In the evenings, again, I use mainly, I'm a fan of tinctures. I've discovered some edibles lately. In fact, I've discovered some of your 1-to-1 edibles, which are great to use in the evenings. And then, of course, just before bed, I'm a chocoholic. So your dark chocolates are right on my regime. So I tend to take about an hour before I go to bed. I tend to take some chocolates, and that'll last me through the night. So what I've noticed, what I've done is I've covered my entire day with some sort of a product that has a effectiveness of either immediately working for 2 hours, working within 20 minutes of the work for 4 hours, or work for 10 hours like all night. I wish that my herniated disc in my neck or the pain I have from my knee replacements would go away. It's not. And so I have to be able to manage it. And I've been able to effectively manage it and keep my pain level below a 1. And more importantly, keep my sanity, be able to be level-headed, run businesses, be able to do what I'm doing today without being high. And so the answer is that's there. In the follow-up to this webinar, you'll get an email that has a link to the video, so you can actually watch the video again. You get a link to the presentation. We'll also give you the recommendation of what I use for my post-surgical regime. We'll put that in there as well, so you can actually take a look at that as well. And I hope that answers that question. So I'm going to the next one. Why does it seem to help anxiety sometimes and cause it other times? I think this has to do with that therapeutic effect. Is that safe to say, Taylor?
Absolutely. THC could definitely be a factor in that. It also could be the percentage of a terpene in the entire terpene profile, right? So you could have a strain that has limonene in it, but it might not be too prominent in that terpene profile, and then go to a different time or even a different batch of that same strain, and it has an even higher terpene profile with that specific one. So it also could do with outside factors, THC. There's not one question or one answer for this, unfortunately. It could be a lot of different factors, but again, your best bet is just to, if you feel like it works, great, and that's awesome that you found the relief. And if you feel like sometimes it doesn't, cut back on that or add in more CBD into that specific route that you're choosing to use, or that specific strain that you're using, or whatever the case may be. Adding CBD will help with your anxiety if you feel like it's being a little too much.
Yeah, I would say lean towards the CBD side, and again, cut down on the THC side. It'll probably help quite a bit. Good advice. The next question, I don't know. I'm kind of trying to figure out this question. It says, "I'm disabled since 2020. Are the records completely confidential? I take medication for anxiety, stress disorder." I believe all medical records that you handle at, I know in the clinics, as well as if you have any medical record access in Surterra, they are handled confidentially. Is that correct?
So I'll take that one. So medical records in Florida concerning medical marijuana are covered under HIPAA. So that's all protected health information. The only way that anybody else would know is if you tell them. That being said, I'm always going to stress, I highly recommend being open and honest with your doctor about all of the medications that you're using, including medical marijuana, just so that they have a complete picture of everything that you're using.
Sure. Let's move on to the next one. It says, "I can't sleep. I have bone on bone shoulder pain in both shoulders. Don't like to smoke anything. I also don't like feeling high. What can I take?" I'm going to just throw that. I'm going to throw out a quick answer, and then I'm going to let Taylor and Zach take this one. I tended, when I had my bone on bone knee issues, I tended to use tincture drops and really pay attention to finding a product that reduced the inflammation in those joints, because by reducing inflammation, it reduced the pain. If you just try to attack pain by itself and you don't reduce the inflammation, it'll cause a problem. Your thoughts, Taylor? Hey, Taylor, I don't know. We think we might have lost Taylor. I don't know.
He's on mute, I think.
Oh,
Sorry.
okay.
I think we're good. I would agree with that in that aspect. I believe caryophyllene would be the terpene that you would focus on to help reduce inflammation and ease discomfort. When it comes to not feeling high and you don't like smoking anything, the routes that I would recommend would be a topical route. That would be my first recommendation. With a topical route, depending on where you get it from, it's going to kick in pretty fast, about 15 to 20 minutes, and it's going to be an all-day relief, 4 to 6 hours or 4 to 8 hours, depending on the product. There are some products out there in dispensaries that can be transdermal patches, which can pass through that barrier and make you feel a little euphoric or high. Or could be some that can last more than 4 to 6 hours. But typically, that's always a good route to start with, is a topical, because you're able to add it to the affected areas that you need to. Most of the time, no euphoric feeling, and it's an all-day relief. An alternative to that, as Marc was saying, is a tincture or anything that's going to be possibly a higher CBD ratio to start with that. Because again, you don't want to have it too high on the THC. You don't want to feel euphoric. Starting on that higher CBD ratio is better for inflammation. And a tincture is going to also be that 6 to 8 hour duration. So that would be my recommendations.
Yeah, and I think that pay attention to inflammation, not just the pain, because reducing the inflammation will help you, especially in the bone on. What's causing your bone on bone pain is really a lot coming from the inflammation that's there. One other question that did come up says, "I take a daily prescription medicine for anxiety, depression. Will medical marijuana interfere?" Amy, you want to take that one?
Yeah, absolutely. So the biggest thing is understanding that medical marijuana interacts with different receptors than those medications. That being said, medical marijuana does have the potential to increase the effects of those medications. So you always want to start at a very low dose of medical marijuana and then slowly work your way up to a point where you find the relief that you're looking for.
Sure. What's the best part of the plant to consume for sleep disorders? I'm going to throw the quick answer out as terpenes. Anyone else want to jump in on that one?
I think with certain types of what the cannabis plant is, again, trichomes, Keep would be a great product for that, is isolated trichomes. THCA would also be a potential idea for people looking for more of that euphoric feeling to possibly help with sleep disorders. Essentially, all of it's going to be something that is going to be based on your terpenes. Again, back to what we keep saying, your terpenes are what's going to make that difference. And terpenes that you would need to look for focusing on, myrcene is a great one to start with that. It is going to be great for promoting sleep and muscle relaxation. So that's going to be a good terpene to start with. Myrcene also does open up the opioid receptors in your brain to help receive that terpene a lot better. So that's why I think that terpene would be a good place to start.
Yeah, and I think products that also have a certain amount of CBN in it will help quite a bit as well. So that's really there. Again, join us next week for the sleep webinar. You'll probably really enjoy it. There'll be a lot of good things that are there. Deborah asked the question, what is PTS affected by, and how is PTS affected by anxiety? And can you leave more in, and can you delve more into that? You want to take this one, Taylor?
I definitely can, absolutely. When it comes to PTSD and how I believe how it's affected by anxiety, really just depends on, based on the slideshow that we talked about, how your body receives stress, how your body reacts to stress, and how your body displays anxiety. As an example for myself, mine is definitely a fast heartbeat. I can feel me getting super sweaty. That is something that I know, hey, I'm feeling a little anxious today, right? That's what I'm using to kind of use my body as ways to tell me something's going on and my body's not okay with that. When it comes to cannabis products, absolutely, cannabis can help anybody with mostly, anything that we got going on here. That's what cannabis is a journey for us to find that relief in our bodies. I hope that answers the question a little bit for you, Deborah. Again, with that, and I'm reading your first responder, and that alone, I can't imagine. But what I believe could help would be probably more of an indica type of product. Definitely can be something to benefit that because you have insomnia as well. And again, focusing on that terpene blend to better utilize it for yourself and really craft it for you.
Right. As a first responder, thank you very much for your work. I know it's not it's not a picnic, and we really appreciate what you do. And again, it leads into Ted's question. Ted, thank you very much for being a veteran. I know that a lot of people say that, but we mean it from our hearts. It's something that we really do appreciate. Who wants to take the question about anxiety that comes from PTS?
I'll go ahead and take that one. I've been thoroughly enjoying Taylor and how well she's represented Surterra, and perfect example of how our business is built on the expertise coming out of the wellness centers. Really good discussions going on here. Prior to getting involved with cannabis, I did spend a career in mental health treatment for a little over 10 years. And PTSD was one of the specialties. And even to Deborah's question previously, I just want to take this as a reminder to say cannabis is most powerful when it's like a part of a comprehensive, like a holistic treatment approach. So when it's like filling a piece of that void, and cognitive behavioral therapy for stress, anxiety, PTSD, that's the field I tend to align with most. Extremely powerful, and can be powerful for a lot of folks when treating PTSD. The thing I can say to you, Ted, is that the drinking is going to be exacerbating all of the symptoms you're going to deal with the PTSD, right? So the alcohol is providing a very immediate relief you're getting from the stress. But one of the things to understand is when that alcohol is wearing off, what it's doing to your underlying conditions in the PTSD is making those symptoms far more difficult to deal with. So I highly recommend getting some help and work with a professional on the alcoholism. I worked with a lot of veterans over my years. I specialize in opioid treatment, but I understand, you know, the benefits that alcohol does provide in a quick numb, but it does present long-term challenges. And that is where cannabis is a beautiful replacement. It helps with, a lot of folks find benefit, and it mitigates their alcohol cravings when they're trying to stop their alcohol use, in addition to just helping, like, with all the information Taylor has shared with the anxiety. So I would say definitely get some professional help, and keep working on the struggles with alcohol, because that is going to be exacerbating all the negative things you're feeling with the PTSD, and cannabis could fill in a void there for sure.
Yeah, and I think you're right that cannabis is a good alternative. With alcoholism, I deal with some veteran organizations, and I've heard that over and over again. Amy, you're a vet. Your thoughts?
Yeah, I would say if you are not a VA patient, reach out to the VA and see if you qualify for benefits. They have an amazing amount of resources available to veterans. So it's definitely worth checking out. There's also something called the Vet Center, and their entire job is just to help veterans qualify for VA benefits and help you get through the amazing amount of paperwork that you have to do.
Good. Chris asked a really good question. Do dominant
Mark,
terpenes
before we
matter?
jump to that, I want to shout out, Ted says he's been sober from alcohol for 2 years, so major shout out.
Oh, great.
Really wanted to just shout that out. And so I realized too, I didn't get at the terpene question, and Taylor spoke to it. For me, myrcene is my go-to. You know, the stores really helped educate me in the power of terpenes. I've been an everyday user since '95, and really changed the way I chose cannabis about 1.5 years, 2 years ago, because of a lot of the staff educating me on terpenes. So I laser in on anything heavy in myrcene. It's great for my sleep, pain, really helps knock me out at night. So myrcene is the one. And to Taylor's point, and just all of the discussion on the terpene journey, you know, it's such a bummer that the federal illegality still stops the research, because this is definitely an area we just need to know more about. When the certain terpenes are combined with other terpenes, it causes a completely different reaction. So it may not even be the isolated terpene, it could just be the overall profile. So, but one of the guiding lights in dealing with anxiety, sleep, pain, myrcene is the one for me that I find a lot of relief.
Sure. That's great. Thank you very much. Good comments. Do dominant terpenes matter in regard to anxiety as a flower user? First of all, as a flower user, Chris, be aware the minute you light that joint, you're burning off half of the terpenes, half of the cannabinoids, most of the terpenes and most of the flavonoids. I would recommend, if you want to use inhalation, I'd recommend, as Amy pointed out earlier, a pen that allows you to be able, or a device, a dry herb device that lets you set the temperature so you can get the terpenes that are from there. But there are a number of terpenes that can really help you. Who wants to take this one? I think this is we've talked about this. This is really important.
I would
I'm
love
back
to
and
jump
forth.
in.
Oh, go ahead. Yeah, go ahead, Taylor.
I would love to jump in on some 2 key things. When you're doing a dry herb vaporizer, right? That's going to be possibly conduction heating rather than combustion heating. Conduction heating is going to be heating the air around it rather than combustion, which is burning that plant matter, which is why lighting a joint can burn off those cannabinoids and terpenes right off the bat, right? So that could be one thing. Changing that heating, the way that it's heated around it, is what's going to make that difference. Also trying to use,
by the way, that's a
hemp
very good point. Thank you for bringing that up. Very good point.
Absolutely. And another thing I would recommend if somebody is a flower user, because I'm heavy on the flower too. I love to use it. It's the, I think that benefits me the most. So I tend to stick with that. Using a hemp wick would be a way better way to have a lower temperature heating when you're lighting a joint, bowl, bong, whatever you're trying to use at that point, because you're not taking that straight flame from the lighter or the torch or whatever you're using. It's going at a lower temperature, and you're preserving the flavor of the cannabinoids, terpenes, and the flower by using a hemp wick, because you're not getting that butane flavor in from that too. So that would be my little 2 cents about that. But Zach, definitely go ahead and chime in with what you're going to say.
Yeah, I mean, I would underscore everything you said, Taylor, and again, just throw out my pitch for myrcene. When I go into the store, it's literally, I want somebody to show me what's the highest you have in myrcene. When it comes to the entourage effect, absolutely it matters. And again, I literally have changed how I choose my flower and products. I want to know about the terpenes. So I go in now and I've found, a lot of folks come in and they're focused on THC percentages, those folks who want a more intense effect. But I've learned that really is being driven stronger by the terpene profile, and really what the terpene profile has in it is helping me get to the effect I'm looking for every time. So absolutely, I think the entourage effect is just as applicable with flower as it is any other cannabis product.
Sure. And I think also paying attention to getting a dry herb device that allows you to be able to set the temperature is important. I know you have some Puffco products that are excellent for that. Is that correct?
We do. So the Puffco products that we have right now are going to be more on the concentrate side of that rather than the flower side of it. We do have a Puffco Proxy that has a flower bowl attachment. So that definitely is a device. Another one would be, PAX has a great dryer vaporizer. I think they have 3 of them now at this point, maybe 4. So there's a lot of devices out there, whether you go to a dispensary or a smoke shop, to be able to hopefully find the device you're looking for.
Yeah, I use a Stokes and Bickle, which is a great product, although it's very pricey. It works very, very well. And we'll put in the webinar that we did on routes of administration, which you can go to our website and you can actually follow that one. We actually give a list of the different devices that you can take a look at using for this particular application. Karen asked a great question: is it CBD, THC, or terpenes that make me sleepy? I'll throw that one out. Who wants to grab that one?
I gotcha. Honestly, Karen, it's going to be a mix of everything. It really is. With CBD, it's going to be something that can help with inflammation. And if you feel like you've got pain and that is being, reduced with that CBD, that might help make you sleepy. It's same thing with THC. Higher doses of THC can be a little bit more heavier in the body for a lot of people. And the terpenes in that strain products can also make a difference. So really it is all of it can make a difference. Understanding what ailments are really you're trying to dive into, whether that's actual sleeping, is it your head keeping you up at night that's not making you sleep? Is it actually just insomnia? Is it pain related to that? So there's a lot of different things to factor when paying attention to what can help you with sleep. But again, short answer to answer your question, yes, all of it's going to make a difference.
Yeah. And again, I'm going to throw a shameless plug in for our sleep webinar next week. We have one webinar we're putting out on medical marijuana and sleep. We also have a bonus video that we're doing on just sleep in general and how it can help you with your health. So there are going to be 2 videos you can take a look at. And we kind of broke them down depending on the subject matter you want to look at, but you might want to look at both of them. Brandon has a great question. It says, as tolerance for THC increases, I'm going to stop right there. And the reason I say that is that I think, Brandon, you need to learn, or you need to practice what I call a cannabis holiday. Every 4 to 6 weeks, I try to take about a day to a day and a half off. A lot of the practitioners recommended as much as 4 days. In my case, because of the herniated discs in my neck, after about a day, my neck taps my shoulder and says, if you don't do something pretty quick, I'm going to let you know you're here. But I think a holiday will help quite a bit. Does anyone want to comment on that?
Yeah, there's a lot of, and even the phrase I think I hear a lot is like people say they're doing a tea break, a tolerance break. And
Right.
For me, I have consumed cannabis every day since 1995. There was during grad school, I took like a 3-year break, but every day, and I would say I still have a very mild tolerance. And that's one of the beauties of cannabis, because you don't have a lot of the same physical dependencies that you see with other narcotics, especially the benzos, the opioids. So for me, to avoid doing the day holiday break, I just like to have some days where, I'm not going to use anything until right before, an hour before bed. For some folks, the thought of having to go a day or 2 with nothing seems to kind of intimidate them. So what I do encourage is that same kind of period, Marc, you shout out the 4 to 6 weeks, like just pull back for a couple of days. I think you would be amazed at how quickly the dosing starts to work again at lower levels. And even just from taking 1 to 2 days from dramatically reducing, but still enough to medicate your needs.
Yeah, I think what's interesting is when I take my holiday, my body can't rely on outside sources to get the endocannabinoids it needs or the phytocannabinoids to address the issues. It has to go back to work. It can't get lazy, and my body does get lazy. It's amazing how well cannabis products work after that holiday. I think you kind of alluded to that, right, Zach?
Yeah, absolutely.
Yeah. And so you'll find it again. You'll find that when you find that sweet spot, taking that little bit of a break, you'll find that you'll again sometimes even need to use less product, but you'll feel the difference. Just pay attention to it, and I'd recommend that. I want to point that out because I think that's really really important. Not a lot of people are aware of or practice the concept of taking a holiday.
Hey, Mark, one thing I'd like to chime in there that came up on a previous webinar is it's been suggested to possibly switch ROAs or switch strains instead of taking a full holiday altogether. So if you're normally a flower smoker, perhaps you switch over to edibles. If you're normally now, you'd still look for those same terpenes that we've all been talking about, but those are ways to do it without going cold turkey, if you will, altogether.
That's a good point, Forrest. That's an excellent point.
Yeah, I just cannot sleep at all if I don't consume some type of cannabis. I will literally be wide awake, tossing and turning. So the cold turkey method just isn't an option for me. But the cutting back works great.
Right. And Zach, I can empathize because I have an extremely active mind. I'm a graduate from Cal Poly in San Luis Obispo in computer science. My mind is always going 100 miles an hour. It's just hard for me to relax. But I find that using cannabis in the evening does help me get into that mental state. And as I mentioned earlier, my combination of both meditating via Tai Chi also helps me quite a bit. So whatever method works for you really is really the key. You have to find out what works for you. Really there. Gene has a great question. I have built up a high tolerance to both THC and CBD. I want to cut back. Again, who wants to take this one? This is a good question.
Yeah, and that Gene is kind of getting at what I was kind of speaking to. For some folks, the thought of having to go cold turkey is an intimidating thought, and then what they would be dealing with. So I would just say, that previous in the discussion when the journaling was being mentioned, it is really important to know like how much you're using, what you're using, and then just start to gradually pull back a little. Reset that tolerance in a very intentional way. You can rebalance that without having to do cold turkey with a gradual pullback.
Yeah, that's a good point. That's an excellent point. Dean is allergic to mango. I think you have other products do you have other Surterra product that you could look at? Is that correct?
Absolutely. The reason why I suggested the peach mango is I don't like mint, and the peach mango doesn't have much of a mint flavor in it. That's the reason why I suggested that one. But we also carry peppermint, more of a spearmint flavor, and we also have blackberry. So there are different alternatives to that, but it is going to be the only product that we have at a 2.5 milligram straight THC edible route. But we also have the lozenges that Marc was talking about, is the soothe ratio, which is a 1-to-1, and that will also be 2.5 of CBD and 2.5 of THC, and that's a lemon flavor. So there are other mints out there in the Surterras. It just depends on how you like the flavoring or if you have allergies.
Yeah, and I want to compliment the Soothe 1-to-1 lozenges. I use those in the afternoon, sometimes late in the afternoons. That help me quite a bit. It just basically relaxes me and gets me there. You don't necessarily need to use mango all the time. That's the best way of putting it. You do have other alternatives. Let's move on. Lee, what else we got? We got some other questions coming here. Can cannabis for anxiety have the same boomerang effect as benzos? Amy, do you want to try to take that one?
Sure. So I'm guessing what Ted is talking about is sometimes when a person is tapering down their dose of benzos, if they've been on them for a long period of time, they can have rebound anxiety. So it would be anxiety over and above what they had previously before they were taking the benzos. Generally, marijuana is not going to give you that same anxiety effect. If anything, it's going to help calm it. But just as everybody is saying, it is going to be dependent on the terpenes that you're getting, the specific cultivar. how you're using the medication, and absolutely the dose that you're taking.
Great, good point. How do you obtain CBN? I'm going to let Surterra handle this one.
Yeah, so I mean, we currently offer a lot of products that have CBN in natural ratio. Florida is one of the states that does not allow us to bring in like other medical markets where they can use hemp-derived cannabinoids. So for the rarer cannabinoids, it's a little more difficult for us, being forced into a vertical system of operation, to have to be able to farm out enough CBN, CBG, and some of the other rarer cannabinoids to manufacture the products needed. But I'll let Taylor definitely jump in on any products that.
I think
It's a
looking
little
for a
hard to
product that
say
has a
as
high
well.
ratio of CBN would be something to pay attention to. But I think you can help people find.
Yeah, so as Zach was saying, higher ratios of CBN is a little harder to find in most products. Almost all of them are going to have some type of percentage to it, but to find isolated CBN is not going to be something that's going to be found in this state right now, to my knowledge, in a safe and effective way to find it to be best. So unfortunately, not a lot is out there for just predominantly CBN, but with that being said, CBN is helpful for sleep. So having products like Zach was saying, myrcene, can be definitely something to help give that similar effect to what CBN can do for you.
Right. Jim has a really good question, and this is: my wife has chronic pain, anxiety, and sleep issues. Where does she start? And I'm going to basically bring up a really good feature of Surterra Wellness. You have a consultation program, which is probably not a bad place to start. I'll let you kind of take it from there.
Absolutely. And I was most excited about this question. So where does your wife start on this journey? It's really going to be what is affecting them the most, and are we able to kind of hit two birds with one stone? Is the sleep issues related to the chronic pain and anxiety, or is it isolated? Understanding what's going to be what's affecting you most in your life is where is a good place to start, and then based on that can be what route you take, your ratio that you would like to work with, and everything else. So really understanding where does those issues stem from, and what is your top priority. That's really going to be what I would suggest on where to start. But as Marc was saying, consultations, just coming in and being able to talk to any bud tender at Surterra, we are able to help give you information, direct you to products that we think might be best. But again, it's just our recommendations. We're never going to give something that's like, this is the end all be all for these products. They just could help on that journey for you.
But I think as soon as you, I think in part of a consultation, you can also find some products and some options. Also journaling. We'll include in our follow-up a journal that we put together for our patient information brochure, page out of our patient information brochure, so you can actually keep track of what works. And again, in going low and going slow, it's important to see when you start feeling the relief. And of course, when maybe you're taking a little bit too much and you begin to see the negative symptoms of it, that's going to be really, really important. So I think journaling and consultation are a couple of good places to start. Lee has a good question about eucalyptol, and I'm going to let you all take that one, but I do want to mention one thing. When you're taking cannabis, it's like taking a multivitamin. This is not something that you take and then you stop. I know that my mother was diagnosed with cancer, and this was 7 years ago. And I put her on a regime using medical cannabis, and one of the things that she was used to is take a pill. Once it starts working, she stops. And when she stopped, she started having some problems. And I had to convince her that you take this on a daily basis. It's much like a multivitamin. And with that said, I'm going to let you all kind of finish off with the answer to this one.
I would just underscore that, Marc. It's exactly what you said. It's not when you would want to stop it. That's, and that's a common symptom in mental health as well. You stop taking the med once it starts to work. But I would encourage you to just keep going. And, I think maybe the question before they start feeling the benefits of it consistently, and maybe Amy, do you have anything also to?
I think it's really just being consistent, like you said.
And every person's body is different. I know some people will react very quickly, some people won't, but if you use it on a daily basis, within let's just say you will see, your body will tell you when it really starts working, and it does work. It's something that really is there. I pay attention to eucalyptus in my regime. I'm a senior citizen. That's something I need to pay attention to. So hopefully it answered that question. With regard to the terpenes that we mentioned, are you saying to look for those terpenes in cannabis products or on their own? I think we're looking at them as part of the cannabis products. Y'all want to take that one?
Yeah, if that,
Yeah, definitely. Go ahead, Zach.
I was going to say, if that's in reference to what I was saying, then absolutely, yes, I was referring to cannabis products that were high in myrcene, is what I tend to look for.
Yeah, there you go. Anonymous had a good question and gave some ratios and some dosing. Again, we cannot give you a very specific recommendation because it really depends on the person itself. But I think if you experiment with it, you'll find out what works. Again, I found out with my wife, it was between a 12-to-1 and a 20-to-1 worked for her, which is best. Now, my wife doesn't have dementia, but she does have the anxiety, sleep, and pain issues. So I think it's a matter of being able to look at that. And I think looking for an approved caregiver. Do you have a caregiver guide that you provide, Surterra?
Not specifically for caregivers, but we always give that same type of consultation to anybody, regardless if they're even a patient or not, because people come in for information. So Anonymous, to best try to answer your question a little bit, one, understanding the difference between CBD derived from the cannabis plant and CBD derived from the hemp plant, which is most of your over-the-counter medications that you're going to find even at like normal natural life type of stores. They're going to react to your body a little bit different, which is why, one, you might have a quarter of a dropper of a CBD ratio derived from the cannabis plant and a lot higher on a full spectrum CBD derived from the hemp plant. So one, that's one thing to pay attention to. But overall, you can always go up on CBD. That is always a journey to go on to, especially people that don't want to be too euphoric. So it's not going to be a product that is going to hurt the process in any way, not necessarily, rather, but you're definitely able to try that journey to see if that works for it, to hopefully eliminate that over the counter, because it's just not going to give that same effect as a CBD derived from the cannabis plant.
Sure. And again, it's very, very dependent. It's interesting. I think the consultation will really help quite a bit, I think, in this particular case. And John just came up with a good question. It's a long question, and I really don't want to dive into too much of it because a lot of it has to do with how he's using it, where he's using it. John, I think the best answer to this question is going to be set up a consultation with and really talk to a professional at Surterra about this. Your thoughts about this, Zach?
Yeah, I actually was reading that question prior to seeing it on the slide, and I've heard this a lot, with some folks. They just, regardless of how much they try to consume through an edible or oral route, they have minimal to no effect that they were looking for. And so maybe Amy, if if there's like a medical condition there. I know there's a lot of different literature on the whys behind it. For me and some of the folks who tend to consume or struggle with edible use, there's like milk thistle, things like that we take to enhance effects. So Amy, I don't know if there's anything.
Well, I think part of this, Amy, also want to mention, part of this is also your route of administration, because vape pens versus edibles are big difference in when you're going to get relief.
Certainly. And one thing I noticed that John hadn't mentioned at all is RSO.
Right.
RSO is a great whole plant product. It is very strong, and it sounds like you've already tried several other products that are on the stronger end. So it's just another thing to try.
Yeah, and 185 milligrams of an edible dose that's a haymaker for, I would say, 90% of patients, right? So that is a heavy dose, and if you're not getting any effect there, and you need more intense. This is where, even for new to cannabis patients, don't be intimidated by concentrates. That there's a lot of companies now that are making devices. Even for myself, I was very intimidated by the whole blowtorch and heating of glass. I stayed away from it. Now there's electronic devices that can heat, and now I can use concentrate. So maybe it's going up to a very high potent, high concentrated form, and at those higher temperatures may be a higher level of intensity. Taylor, anything that you would add on?
Yeah, absolutely. So for one, John, it seems like that you are taking more of an oral route, oral edible. Not everyone can metabolize that in their body that way. And that makes it harder for people to go that route of something that is a longer duration if their body doesn't receive it that well. So one, I'm happy that you found a flower that worked for you. That is amazing to hear. As talking about your routes of administration, a topical might also help with that back pain, because that kicks in faster than an oral product's going to, and it's almost that same duration. So trying different products, different routes of administration, not sticking with just an oral product, because that might not be what your body is receiving. Amy, I hope that information is correct based on what I know about it. And if you have any, okay.
Yeah, it is. And I think it's just finding that route of administration that works well. And from what John's saying, flower or the inhalation route seems to be working a little bit better, versus it looks like all of the other products that he was using were taken orally. So it may be a problem with oral absorption or absorption once it's actually in the gut.
Yeah, and I even just thought too, it may even be something as simple as, like, are you trying to consume the edible shortly after eating food? I know I always struggle. If I'm on a full stomach, I can take superhuman doses and not feel anything, so it could be something as simple like I like to take my edibles on a completely empty stomach, and then I like to eat something 30 to 45 minutes after I've taken the edible. That tends to give me the max benefit for the dosage I'm taking.
Right. And I have to tell you, with herniated discs in my neck, the definition of pain is here. I mean, I was living in a level of pain of an 8 or 9 when I woke up in the morning. I think there are three comments that I'd like to make on this. First of all, take a holiday, give your body a break, let it reset. I think that'll help. It looks like what you're doing is you're putting the pedal to the metal and trying to do as much as you can. And in certain cases, that's not necessarily the best way to take full advantage of cannabis. Is the best way of putting it. I think the other is take a look at the different routes of administration. Your inhalation. I agree with you, Zach. The vape pens I use are actually concentrate pens, and I find them very, very effective. And it's something I've only really been using the last 2 to 3 years. You have a bubble hash, for example, that I think is really great to really take a look at. So really take a look at routes of administration. Take a look at the holiday. Don't necessarily rely on things that you take and put in your stomach, because it looks like that may not necessarily be the best route. That's from your history. It looks like may not be the best route to go. Any other comments that people want to make? I think the comment about not doing it right is exactly there. I think it's a matter of just resetting and getting, again, different routes of administration and really getting back into that. Other than bedtime, Karen asked, other than bedtime, I only take something when I'm in a panic state or expecting a high stress day. Is being inconsistent detrimental? I think it is, but I'll leave that up to Amy and the rest of you.
Um, I I always tell people there is no side effect if you stop suddenly or decrease your dose. That said, having a consistent routine can help better control the symptoms that you're having, especially if you are having anxiety or panic. Being consistent about what products you're taking, when you're taking them, how much you're taking, can be very helpful. And I see that you sometimes take stuff during the day, which is really great. That's totally fine. But if you don't need it, that's okay as well.
I just had a quick thought, and excuse me, I don't want to get away from Karen's question, but on the other question we had about pain relief, one of the things I didn't see in that formula was topicals, and topicals might be something to help quite a bit. I found that in my particular case, topicals are very, very effective. They work almost immediately. and they'll last for 2 to 3 hours. So it's something just to throw in there. Sorry, I didn't even get away from Karen's question. Karen is important. Eileen asked a question about expired products. This is right up Surterra's alley. Your comments.
Yeah, you know, we put expiration dates on all of our products, and we do encourage patients to follow those dates. I don't have any information. Maybe Taylor does. We've never had a patient tell us they've had a product that was 3 years old and unused.
Yeah, I mean,
uncharted
it's
waters
kind of
there.
tough. Yeah, like Zach was saying, we put expiration dates on them just for a better understanding of guidelines and making sure that it doesn't go too long. One of the reasons that it would affect anything is over time, depending on the product, your THC can go down, you know, depending on if it's a flower product, how it's extracted, whatever the case may be. But for you, Eileen, with you being having a topical, I can't say for sure for certainty, but I don't see that it would expire because it is already in a very specific formulation that isn't going to have like air oxidizing to it. It's not going to be something that has aged flower to it. It's already made into a patch. You definitely is not going to hurt, but it just might not be as effective. That would be my take on that.
Yeah, I think it'd probably be less effective potentially, but I think it's fairly safe to use. That's safe to say. Your comments?
I agree. I think it's I again without having any you know, don't shoot the messenger about it, but I think it'd be okay. It just might not be as potent or as strong as needed.
Well, we have just spent 2 hours talking about anxiety and stress. And first of all, I want to thank everyone who is still on the webinar. I know that this is an important topic and something that we all want to take a look at. And I think it's important to point out that we've had a lot of great questions, and I hope we gave a lot of good answers. Anybody have any final comments? Zach, you want to start?
Oh, yeah. I just really appreciate the invite. It's a pleasure to be with everybody today. Amazing questions. It really speaks to the importance of we have a lot more work to do in the education and awareness of the community. The Florida market is growing massive, but it's still like 3% of all Floridians. So a lot of work to do on spreading the education and benefits on this really powerful plant that's bringing a lot of people relief. So Marc, thank you, and MMTC for everything you guys are doing on the front, and Amy as well. You know, I know you guys have always been great partners in the field.
Well, and by the way, I want to thank you all. First of all, I want to thank you all for sponsoring this. This has been very helpful. But I think you can also see there's a lot of folks that really, you know, have questions. And you have done a great job as a dispensary, providing the terpene information, providing the consultation, and candidly providing the locations for people to be able to access it. I think that's really, really important. So thank you very much.
A big shout out to Taylor. Crushed the questions there, and really proud of all of the staff we have in the stores. And it really is the thing that has brought us success in Florida, is the expertise coming out of our wellness centers.
Yeah. People make a big difference, and you know that's that intangible. And Taylor, you knocked it out of the park. Thank you very much. We tested your knowledge. Didn't get a chance to test Zach that much, but we definitely had a chance to test you tonight. Thank you very much. Great answers, by the way. Great job.
Thank you so much. And, you know, thank you everybody for participating in this, and you guys for hosting this. Having advocates like you guys in our corner is what makes this whole community just so much better in having that understanding of knowledge. But one thing I do want to say to anybody willing to go to dispensary, there is no such thing as a dumb question, and there's no such thing as a bad answer. You know, we are here as dispensary workers to help you on your journey and feel empowered in the knowledge that you are taking. So don't ever feel like it's an intimidating experience, or it's, you know, you're anything to be afraid of. Please come and talk to us. We are here for you guys. We love to answer your questions. And honestly, every circumstance is different. So we love to get all those different takes and understandings and routes. So, you know, bring them on in.
Yeah. And I always say that if just one person watches this webinar and they're able to get their life back, we've been successful. And hopefully we'll be more than that. But I think that's really the objective of why we do a lot of that, is really helping people get their life back. Forrest, your thoughts?
Oh, it's been great to be here again. Obviously, again, Taylor, you have been awesome crushing all these questions. You can see the focus that we put to make sure that our frontline workers like Taylor and their teams are really equipped to be able to answer all these. For those that are struggling with anxiety and stress, I think we learned tonight you can definitely find help in the cannabis plant. Pay attention to cannabinoids, pay attention to terpenes, because they are going to be your saving grace on finding that relief that you need. Journal and figure out what works for you, figure out what doesn't work, and just, it's a never ending process, and good luck to you.
Sure. Amy, great comments as usual. And by the way, thank you very much for helping with the video. Your final thoughts.
Yeah, just always really glad to be here and to help. And I have to say, I always learn something as well. Taylor, you had amazing answers. And I always recommend, if you do have questions, stop into a dispensary. You can get a consultation. And I know Surterra has some absolutely wonderful staff, so highly recommend them.
Great. Well, I want to thank everybody for really hanging in there for 2 hours. I think that cannabis is really important. I know a lot of questions come up about where do I get a card, and I recommend the Medical Marijuana Treatment Clinics of Florida. They also have dispensaries or clinics in Mississippi and Ohio. And again, you can go to Surterra Wellness, find a physician if they're not a local one that MMTC doesn't have. But I also recommend taking a look at Surterra Wellness. They have a great set of products and have really done a really good job of making sure that you have the consultations, you have the terpene profiles, and more importantly, you have the people to really be able to help you that are really there. There's a My Botanical Wellness site. As Zach mentioned, CBD products are not something that is in the purview of a lot of the dispensaries. A lot of customers ask, where do I get a quality CBD product? Because they are not regulated like the dispensaries. We have gone out of our way to be able to find physician recommended CBD product, and that's really what it's all about, to be able to help you there. I want to thank everybody for joining us. Next week, we're going to be talking about sleep. But more importantly, thank you very much for joining us tonight. I hope you have a good evening. And again, I hope that this helps you get your life back.